Hello and welcome to the award-winning Waterman Wellness, your pathway to health and wellness with local experts as your guides. I'm Michelle Wargo. Coming up in this month's episode, a Lady Lake woman shares how collaboration with her doctor helped her make gains against osteoporosis. You'll find out about a number of fun and informative hands-on classes to help you be fit for life. And local experts discuss an advanced prostate cancer treatment with little inconvenience for patients. We begin with a significant accomplishment for a Lake County hospital. That is good news for the entire community. After months of effort, Florida Hospital Waterman has received accreditation from the Society of Cardiovascular Patient Care after demonstrating expertise in chest pain diagnosis and treatment.
A lot of times patients come in with a primary complaint of chest pain, but we don't know what the cause is. In the emergency room, we always start with cardiac. It's your heart, until proven otherwise. The accreditation ensures that we follow a process, that we rule out things before we basically eliminate them.
What that means for patients is that we're able to coordinate very efficiently the care they receive for any complaint regarding chest pain. And this has tremendous impact and value for the community. For us to be able to provide extensive care in the short time frame necessary when a patient needs it is very valuable.
Heart attacks are the leading cause of death in the United States, with 600,000 people dying each year of heart disease. More than 5 million Americans visit the hospital each year with chest pain. The accreditation also demonstrates the hospital's excellent coordination with the local emergency services. Bonnie and David Goodman know firsthand about the importance of best practices for cardiac care in the emergency room. David was rushed to Florida Hospital Waterman after suffering a heart attack, where the emergency team's quick actions saved his life.
Without them and their emergent care, he wouldn't be here. There's just no way he would be here. The kind of heart attack he had, only 2% of the world's population recovers from. And I know if he'd gone somewhere else, it would have been all over. I wouldn't have him anymore.
When seconds matter, we can take care of you no matter what the issue is. In chest pain, there are a host and a number of different problems that can be occurring. What we've done is, over the past year and through chest pain accreditation, formed processes to help take care of any complaint that you have.
To learn more about the accreditation and to find helpful resources about heart health, including a free online risk assessment, visit fhwatermanheart.com. Educating the public about advances in breast cancer treatment and raising awareness about the disease is the mission of the Pink Army. Florida Hospital Waterman is making plans for October, Breast Cancer Awareness Month, and will offer plenty of free resources for the local community. Cancer survivors will share their stories, and local experts will explain how treatment advances are leading to better outcomes. Music, fun, and pampering are also part of the Pink Army's plan. The October festivities kick off on Thursday, October 1st, when Florida Hospital Waterman officially goes pink. The Pink It Up celebration is open to the public and many activities are planned. You'll learn about advancements in radiation oncology at a free presentation with Dr. Anud Jain on October 8th. Put on your running shoes and join the community at the second annual Pink It Up Pink Army 5K race. The event will be held on Sunday, October 18th. And you can find out about new options for treating breast cancer, presented by Dr. Boris Mascarenas. The talk will be held on Tuesday, October 27th at 1 p.m. Visit jointhepinkarmy.com to learn more about all of these community events. We turn our attention to the guys with important information about prostate cancer. As the second leading cause of cancer death in U.S. men, prostate cancer kills 29,000 men each year. Yet when diagnosed early, the 5-year survival rate is 100%. Doctors say the prostate-specific antigen screening, called a PSA test, can play a critical role in the diagnosis.
There's been a lot of controversy over the last 5 years in who should undergo PSA-based prostate cancer screening. If you've picked up a newspaper lately, you might have run into a couple articles that several agencies have recommended against PSA-based screening. PSA screening isn't for everyone, but for young patients, especially with a family history of prostate cancer, once a year blood test and digital rectal examination to check for prostate cancer is still a good idea. That exam is very well tolerated and, for most people, quickly forgotten.
If diagnosed with prostate cancer, Florida Hospital Waterman radiation oncologist Anut Jain says advanced treatment available right here in Lake County offers good outcomes.
What brachytherapy is a specialized type of radiation that's actually delivered internally, where small sources of radiation are placed right next to a tumor. It allows for higher doses of radiation to be given to the tumor, and it's much more focused, so there's less radiation given to the normal organs. Typically there's an applicator placed right at the location of the tumor, and the radiation source can go right to the tumor, so it can give the highest dose to the area at risk and the lowest dose to the normal tissues. And the higher dose can result in better outcomes for the patients.
You'll also find a variety of all types of cancer resources on the website fhwatermancancer.com. We know adopting a healthy lifestyle can help prevent cancer and many other diseases. Sometimes we need a little encouragement and guidance on how to do it. The Recreation Health Center at Florida Hospital Waterman is offering a variety of classes for the community to help anyone learn to make the right choices.
Lifestyle change programs are 6, 8, and 10 weeks. We have the Yum Yum Club that's coming up, and we'll be teaching people how to become familiar with fruits and vegetables and including more of those in their menus for their daily enjoyment. We will have other classes that are basically lifestyle. We have a brain fitness class. So we're going to be adding more and more kinds of programs on stress management, relaxation, anxiety reduction.
If coming up with healthy meal ideas stresses you out, you'll want to check out the Yum Yum Club Cooking School. Sign up for one class or the series, which begin in October. The fee for this hands-on class includes the food and cooking utensils you'll need to create delicious and healthy recipes. Improve your memory and keep your mind sharp by signing up for Super Noggin. This 10-class program will meet Tuesdays at 10 beginning October 6th. The cost is $50. And you'll find out the best way to integrate activity into your busy schedule with Fitness for Life. This 10-week course is 2 classes in 1, combining the elements of physical activity with healthy nutrition. If you or a loved one has diabetes, you'll want to plan to attend the Diabetes Self-Management course, which will be held on Monday evenings beginning October 5th. You'll learn how to control blood sugar and manage sick days, medication, exercise, and meals. All courses will be held in the Recreation Health Center at Florida Hospital Waterman. Visit the website to find more information and to register. It's time to take a short break, but we'll have plenty more when Waterman Wellness continues. Find out how some Lake County children learned how to teach lessons about good health to their families. We'll head to the Recreation Health Center kitchen for a breakfast recipe that will start your day right. And you'll learn how doctors can now easily diagnose osteoporosis and then treat the dangerous condition. You'll find additional health and wellness information in Waterman Wellness magazine. Visit watermanwellness.com to arrange for home delivery. And you'll also find a listing of the specialists featured in this month's episode. First, here are upcoming events that you or a loved one may want to put on your calendar. We'll be right back. Welcome back to the award-winning Waterman Wellness, your pathway to healthy living with help from local experts. I'm Michelle Wargo. According to a recent report, 1/4 of all American women aged 65 or older suffer from osteoporosis, putting patients at dangerous risk for fractures. This condition, which causes a weakening of the bones, is most common in menopausal women, but men can also suffer from it.
Osteoporosis basically is a thinning of the bone, and we divide up into normal bone, osteopenia, which is loss of bone to a certain percentage, and osteoporosis, which is a risk factor for bone fracture. Because osteoporosis is silent, you can lose a significant amount of bone, and some people feel as though by the time a woman is 80, she'll have lost 30% on average of her bone mass. So it's a significant decline after the menopause. There are lifestyle factors. Smoking is one of the worst things that someone can do.
Benny Dugan of Lady Lake learned she had osteoporosis after Dr. Pillow diagnosed her mother with the disease. He suspected she was at risk and ordered a screening.
There's some laboratories we do for my patients that we do a DEXA scan. The DEXA scan looks at the hip and the spine and gives us that T-score.
It's a scan of your body. You're lying down and it scans your body and checks out your bones. And it is not uncomfortable, it's not difficult, and it's not long. And I don't dread it. You know, it's a good test because it has told me exactly where I stand.
In addition to exercise and good nutrition, Dr. Pillow said there are a number of medication options to help.
There are mostly pills. There's a group of them. Some are once a week, some are once a month. There's one called a ranked ligand. It's a different capability. It stimulates the bone to grow more bone. It's called Prolia. It's a twice-a-year injection.
He recommended the Prolia injection, which I take every 6 months. And last time I was tested, it was much improvement. In fact, they said it might even could be called osteopenia.
Dugan took Dr. Pillow's advice and took up walking, and she joined a gym. She also takes vitamins and supplements which promote healthier bones.
He's pleased with the vitamins and the calcium and the D3 that I take, and those are all helpful in controlling osteoporosis. The fact that the test showed that I had great improvement made me feel a lot more confident.
Osteoporosis is just one of many conditions women should be aware of. Lake County residents should know they can now find specialists for all of their healthcare needs in one location. Lake Wellness for Women, OBGYN, recently opened their new, larger office in the medical office building at Florida Hospital Waterman. The doctors recently celebrated their new location with an open house where the community was invited to meet the physicians and learn about the services available.
So we see patients from as young as 14, 15 to as old as my oldest patient is 93 years old. I know a lot of people think, okay, I'm done having kids, I don't need to go to the GYN doctor anymore. That's not really true. You still need your annual exams. We need to do your pap smears and your mammograms, and just make sure that you're, maintaining a good health. Well, this is a much larger office than we had before, and we'll be able to do a lot more procedures here. It's easy for us to actually get from here in the office over into labor and delivery. Somebody's in labor if we have to do a stat C-section. So there's surgery here. Everybody's pretty much in the same building.
You can find a specialist knowledgeable in women's health by visiting watermanwellness.com. Experts say breakfast is the most important meal of the day. The key is making sure it is packed with nutrients you need to help get you through the day. We now visit the Con Recreation Health Center kitchen, where you'll learn how to make a breakfast casserole that contributes to healthy aging. Do you feel rushed in the morning? Well, no matter what your age, breakfast is the most important meal of the day. So we have Florida Hospital Waterman Executive Chef Dave Atkinson, and we have registered dietitian Stephanie Bassett here to tell us why. They're also going to share with us a yummy recipe that will give us enough energy to make it through the day. So what are we making?
We're making baked oatmeal this morning.
Baked oatmeal?
Yeah.
All right, so what goes into that?
Well, this is a little bit different than your average oatmeal. It's got fresh fruit and nuts, a little bit of egg, honey, milk, oats of course, and fresh bananas. And it's going to bake up kind of like a bread pudding. First thing we're going to do is slice our bananas and put some of the blueberries in the bottom of the pan. and then we're going to bake that so they get nice and soft, and then we'll put the rest together.
Oh, all right. So why is this good for us, and why does it keep us going?
There's a lot of different reasons for that, but primarily we have pecans or walnuts for this recipe, and they can reduce our risk of heart disease.
Always good.
Yes, and they're also a really good source of fiber and a really good source of protein. And the older we get, we need to think about where we're getting our protein from.
So here we have our sliced bananas and blueberries, half the nuts and a little bit of the honey and some cinnamon, and we're just going to bake that in the oven for about 15 minutes. Okay, I think it's been about 15 minutes, so we'll check on our bananas and blueberries. So now what we're going to do is we're just going to pour our wet ingredients over the bananas.
So this is really anti-aging is what I'm hearing.
Yes, I would say so. The older we get, we need to be more careful about what we're eating. We want to be specific about getting more nutrient-dense foods. So this is a very good example of that with your fresh fruit, your oats, and then your nuts, because it's going to keep you going, it's going to give you the fiber you need and the protein you need. So less calories with more nutritional benefit.
We're going to go back in the oven for about 30 minutes. Okay, so it's been about 30 minutes, and it looks perfect.
You made it, Dave.
And there we have it.
If you'd like the recipe to make baked oatmeal, visit watermanwellness.com. Recently, some youngsters in our community learned about healthier lifestyles, and they had fun doing it. Choose this day who you will serve. Approximately 60 children participated in Florida Hospital Waterman's Vacation Bible School. This was the first time Creation Health offered a vacation Bible school in a hospital. Through a number of activities, including games, making crafts, and singing and dancing, the children learned important lessons they can bring home.
So with Vacation Bible School, we're able to talk about a connection with God, but also being the whole person, which means spiritual health, mental health, and physical health. So think of the impact teaching children that philosophy, and then each of those 60 children going home and sharing that with their family members, and what impact that might make in our community.
We hope you've enjoyed this month's episode of Waterman Wellness, your pathway to healthy living with help from local experts. Be sure to watch for the October episode right here on Lake Sumter TV for some of the following stories. We turn attention to breast cancer prevention and treatments with some help from the Pink Army. A local orthopedist explains how new protocols enable some patients to have necessary joint surgery while experiencing hardly any pain post-op. And you'll learn how to turn a seasonal fruit into a tasty treat. It's delicious. To learn more about the experts featured in this program, please visit watermanwellness.com. Until next time, I'm Michelle Wargo for the award-winning Waterman Wellness.